Hello and welcome to episode 12 of season 6 of the Fat Toddler podcast. Blah. Pop my teeth in, do it again. I'm not going to actually do it again. I'm going to start this episode with a trigger warning up front. This episode is going to be dealing with eating disorders in depth. So if that's something that you are navigating personally, if that's something that's unlikely to cause you distress in any way, then take care of yourself first. If you have lived experience of an eating disorder, none of what's coming up today is going to be news to you. People in the fat community, and I'm really only speaking about eating disorders in fat people in the fat community with the lived experience of eating disorders have been talking about this for years. I'm not bringing anything new to the table. I'm not an expert. I don't have personal lived experience, and I want to put that out there right from the start. You've been saying it, I've been listening. I'm just bringing the clinical evidence today to back up what you already know. I'm just bringing the facts, the data, the receipts. The lived experience belongs to you, belongs to the community, and yeah, if that's you, then you already know all of this stuff. I'm going to start the episode with a report that came out in 2021 in the UK Parliament from the Women and Equalities Commission. It's called Changing the Perfect Picture. And we talked about it a lot when it came out, and it's kind of fallen out of fashion now. But the report, this parliamentary report, found a large majority of adults and children have negative body image. No shit. And they listed a whole bunch of reasons: unrealistic media portrayal, appearance-based bullying. They talked about racism and colorism. They talked about societal pressure to be image focused. And they said, like, negative body image resulted in low self-esteem, anxiety, depression, and of course, eating disorders. And actually the committee's response was quite radical. They, around the same time, there's this whole kind of calorie labeling on menus, which is a delightful thing that happened in the UK. Nowadays, if you go to a restaurant, the number of calories for every meal is on the menu. But they called for a scrapping of that scheme even before it really took off. They refused to support the government weight loss policies and so-called obesity policies because, guess what? The committee found out that no one has actually ever reviewed whether these policies work. So they said, until you have evidence that they work, we want you to scrap them. Oh, it's pretty bold as far as I could tell. Of course, the government predictably ignored them. And we haven't done anything about it since. We've known for a really long time that dieting causes eating disorders, right? There's lots of evidence. There's a Project Eat, a big study in Minnesota where they looked at adolescents who were using what they called unhealthful weight control behaviors. And they found that they were significantly higher risk of disordered eating 5 years after that. So kids who diet in their teens ended up much more likely to have eating disorders and disordered eating after that. There was another study that took place in Australia where they found that dieting was the single most important predictor of new eating disorders. I say it again. Dieting was the single most important predictor of new eating disorders. Severe dieters were up to 18 times more likely to develop an eating disorder than non-dieters. I say that again. 18 times. 18 times. It's not a little risk. It's not a theoretical risk, a small risk. 18 times. So what counts as severe dieting? Fasting, skipping meals, very low calories, rigid food rules, avoiding entire food groups, using extreme weight control methods, which includes medications. Do these sound familiar to you? How many of you have been doing that for years, maybe longer? How many of you were taught to do that from a very young age? How many of you went to Weight Watchers when you were a kid? How many of you went to fat camp? How many of you had parents who were severely restricted how much food you could have? How many of you had parents who didn't let you eat foods that your siblings were allowed to eat? How many of you were counting calories, skipping meals regularly, had very rigid food rules that were forced upon them from a young age? How many of you were told to avoid entire food groups? And how many of you were, doing what you could to be thin as teenagers? 18 times more likely to develop an eating disorder. All of this stuff, these very things, these unhealthful weight control behaviours, the severe dieting, the very same thing that NICE, the National Institute of Clinical Healthcare and Excellence, actually recommends for people who are fat. Like, it's literally baked into the recommendations. So, in summary, doctors are prescribing eating disorders to their fat patients. They are prescribing disordered eating, which leads to eating disorders, and they are doing so legitimately, using legitimate methods through the National Institute of Clinical Healthcare and Excellence, our governing body, the source of all of our guidelines. And here's the thing that we don't understand, you do probably, but the rest of the world doesn't. That eating disorders don't look how you think. We have these stupid misconceptions. For example, the most common one, that eating disorders only affect underweight young women. This is wrong. This is just because everyone else was excluded from the literature, from the teaching and the training, from the social media and media. Like, it's just, everyone else has been excluded. Black people were excluded from the conversation. Fat people were excluded from the conversation. Transgender people were excluded from the conversation. Men were excluded from the conversation. Males, I should say. Everyone else has just been excluded. It doesn't mean that it doesn't happen. It's just that we're not paying attention to it. And actually, a lot of these people are excluded from the definition. Well, certainly fat people are excluded from the definition, because according to the DSM, which is the diagnostics manual. The DSM is American, and according to the ICD-10, which is by the WHO, which is an international classification of diseases, both of those require you to be underweight in order to have a diagnosis of anorexia nervosa. The ICD-11 has changed things a little bit. Not enough, but a little bit. But yeah, everyone, especially fat people, are excluded from this conversation. And that's not okay. It's not okay. In actual fact, when you look at the evidence, eating disorders are more prevalent in people with higher body weights than people with normal weight. Quote unquote normal weight, right? I don't believe in normal, but when it comes to weight. But if you're just comparing, eating disorders are more prevalent in people with higher body weights. And of course, then the next assumption is, fat people with eating disorders are binge eating. Thin people restricting, fat people binge eating. Again, that is a stereotype that is soaked in weight stigma and couldn't be any further from the truth. First of all, I would like to argue that binge eating disorder is a restrictive disorder. People tend to binge because they've been restricting. And we talked about that in the last episode, right? That restriction led to binging. So a lot of people who are quote unquote binge eaters are also restricting at the same time. But even if you just look at the restrictive eating disorders, even if you just look at what the data says about people with anorexia nervosa and to a degree bulimia as well, that actually the number of people, adolescents, I should say, with who are higher weight and have restrictive eating disorders increased massively between the 90s and the middle of this century. So between 1995 and 2015, according to one study, the restrictive eating disorders like anorexia in higher weight in adolescents increased 11 plus fold. 11.5 times fold. That's what we were seeing. Why? Again, it goes back to the fact that everybody from the 80s and 90s have been going on diets. Diets predispose you to eating disorders. So is it any wonder that fat people who are dieting all the time are developing eating disorders in droves? And these are just the ones that have been diagnosed. Forget the ones that haven't been diagnosed and are being ignored. There's one study that looked at all the adolescents admitted to a specialist ED unit between 2007 and 2011 and found that over a third of them with restrictive eating disorders were higher weight. A third of them. And these were the ones that managed to get into the unit, which again is really hard to do, as you probably know. Despite this, anorexia diagnosis is reserved for those who are underweight, and anyone else who is not underweight gets a quote-unquote atypical anorexia diagnosis. It's like a name that is designed to separate the real ones from the ones who are fat. So it's basically a diagnosis plus weight stigma. Diagnosis plus. You know? That's how we do it. And this is how we're doing it across the world, everywhere. It's just how it is. So wrong. So unbelievably wrong. I want to make it very clear that just because you're a fat person with an eating disorder doesn't mean that somehow you're going to recover better than a thin person with an eating disorder. It doesn't mean that your prognosis is better. Quite the contrary, actually, and we'll see that in a minute. But I just want to point out at this point in time that what we call disorders eating in a thin person, we call a healthy lifestyle change in a fat person. What we call concerning in thin people is compliance in fat people. If you're a thin person with unexplained weight loss, that is a red flag. We immediately question, is it intentional? Is it unintentional? Like, what's going on here? Is there a disease process going on? We do all the tests, all the bells and whistles. But if you're a fat person who is losing weight, and we've demonstrated, we've been measuring you, and we look and we go, oh, you're like several kilograms lighter this year than you were last year, we will celebrate it. We will celebrate it. And at no point in time do we think, oh, maybe this is a sign that something bad is happening. A red flag if you're thin, a green flag if you're fat. Eating disorders are only taken seriously at lower BMI. That's the only way you can get access to treatment. It's the only way that you can get access to support. I have met many higher weight people with eating disorders who were, even when they were admitted, were accused repeatedly of lying. You can't possibly be eating only that much food, because look at you. You're not losing enough weight. You're not like, they're like doctors, nurses, people who are supposed to be experts in the field will accuse them of lying because their bodies are not responding the way they assume they're supposed to respond. But it's bullshit. None of that is true. We've got all the evidence. I've talked about it ad nauseum. Clinicians in the eating disorder field are still operating on very outdated stereotypes. They are not operating on evidence. Higher weight patients with eating disorders have typically been ill for longer before receiving a diagnosis and treatment. And remember what I said about how actually having fat does not protect you in any way? When it comes to prognosis, it's actually the biggest factors that will determine your prognosis are how long you've had an eating disorder without intervention. That's the biggest one. And how much weight you've lost over your lifetime, or how much weight you've lost recently. So it's the amount of weight you've lost, and it's the length of time you've been losing weight. So if you're a fat person with an eating disorder, you will probably have been iller for longer periods of time before you did receive a diagnosis and treatment, and you will probably have lost significantly more weight over that period of time. And these are much better predictors of physical complications than just what your weight was on admission. We've got lots of studies that show that patients with atypical anorexia experience equal or greater medical instability than those with quote-unquote typical anorexia. When I talk about medical instability, I'm talking about bradycardia, which is a low heart rate, low blood pressure, disturbance in your electrolytes, all sorts of things. And like I said, there's studies. There's lots of evidence. This is backed up by facts, folks. The heavier you are, the longer it takes for you to get a diagnosis, the more likely your doctor is to celebrate the very thing that is making you sick. If you are lucky enough to get a diagnosis, chances are you will not qualify for treatment. And if you get so sick that you end up needing to be admitted, by that point in time you would have been sicker for longer, you would have lost more weight, and your prognosis will be poorer. Once again, fat people are being punished for being fat. Fat people are receiving poorer healthcare. Fat people's lives are being put at risk. Why? Because of weight stigma. That's it, right? It's because of weight stigma. And this is the thing that we know, and I've talked about this. When someone has a long history of restricting and weight cycling, the body adapts. It becomes more metabolically efficient. There's a big red flag, like a post-it note on the recipe book of your DNA that says you can't trust the food supply. And as a result, you are much, much better at holding onto your fat stores. So when you starve yourself, you're far less likely to lose large quantities of weight if you've been doing it repeatedly. That means that weight is not a reliable indicator of your nutritional status, of your energy intake, especially in someone with a history of disordered eating. So when a doctor says, look at you, you can't possibly be starving yourself, that is not true. Weight is not a reliable indicator of that because of adaptive thermogenesis. If you are a chronic weight cycler, if you've been weight cycling for decades, then your weight is not an indicator of anything. Like, this is like real lived consequences. Fat patients are discharged from eating disorders services because their weight loss is too slow. Their weight loss is inconsistent. And instead of clinicians going, oh yeah, this is adaptive thermogenesis, this is what happens, we know this, they go, no, can't be. They accuse you of lying and they send you home. And that's not just gaslighting. That is, which it is, and in of itself is a problem. And in fact, if we think about it, if we just think about the gaslighting expert part of this, it means that you begin to doubt yourself. It disconnects you from your body. Like you know what's happening, but they're telling you that you're lying, and so you begin to doubt yourself. You begin to think maybe they're right. It can really, like, for many people, like, cause them to question their own sanity. Don't forget, when you're not eating enough food, your brain isn't functioning at full capacity anyway. So your nervous system is dysregulated. You're very black and white, fixed thinking, very tunnel visioned, which is just simply not getting enough energy. And so when you finally get the help that you want, and then the nurse or the doctor looks at you and goes, no, you're lying, even though you're not, and even though there's plenty of evidence to show that that's not the case, then that can really mess with your thinking. But beyond that, like, it's actually putting people in harm's way. We talked about it last week, about the harm that comes from dieting. And once again, this is the harm. This is the actual harm. These are the fucking receipts right here. Weight is not a reliable indicator of a nutritional status. It's a fundamental clinical error to assume that it is. To genuinely believe, in spite of all the evidence, that true restriction produces predictable weight loss, ignores everything to the contrary, and denies treatment to the patients who need it the most. I'm putting this episode out there. I haven't talked about eating disorders very often. Like I said, it's not really my place to say it. I just wanted to bring the facts, the data, the receipts. I'll link all of the studies to the show notes for those of you who just want access to those studies. And if you're struggling to get people to take you seriously, if you're suffering and your doctor's not taking you seriously, I'm here. I will try to help you the best way that I can. You could have a consultation with me where I can advocate for you, like with your own doctors. I can help you write letters. I can help you to advocate for you for your care. But even if you just need someone just to listen and to validate you and to say, I'm here, I get it, I believe you, I'm here. There are also some, I'm here, but more importantly, there are some brilliant people out there who are talking about this, have been talking about it for decades, who really know what they're talking about, who can be trusted. There are a small group of fat eating disorder specialists, people who have both the lived experience and the learned experience of eating disorders. A lot of eating disorder specialists, unfortunately, look a certain way. Even if they have had their own experience with an eating disorder, they look a certain way, and that can be off-putting, I think, if you're a fat person with an eating disorder. I cannot stress the importance of reaching out for help. So I want to offer my help purely for signposting or advocacy. and also to encourage you to go out there and to find the people who understand what you're going through and can support you. Find community, I guess, is what I'm trying to say. If you're a healthcare professional and you're listening to this, especially if you work in eating disorders, or if you're a generalist like me and you come across people with eating disorders, again, this is a real problem. Once again, I am demonstrating to you with evidence how much harm we as clinicians are causing our patients. Fat patients with eating disorders wait longer for the diagnosis. They lose more weight over a longer period of time before anyone intervenes. They often can't find a service that will accept them at their BMI, and that results in a worse prognosis. Eating disorders have the highest mortality rates among all mental health conditions. That whole big fucking DSM-4, out of all of those diagnosed conditions, eating disorders have the highest mortality rates. And fat people, once again, are being harmed by you and by me. That worse prognosis is not because of anything that they did. It's because we failed them. The system failed them. Everyone is failing them. That is not okay. We have a responsibility to look out for our patients, to protect them, to do what is in their best interest, to not cause harm. When you prescribe dieting to your fat patients, you are prescribing disordered eating, and you are putting them at risk of an eating disorder. And you're sitting there worrying about, theoretical potential cardiovascular risk, etc. What about eating disorders? Are you not worried about that? Are you weighing up the two risks together? Are you talking to them about eating disorder risk? Even thinking about it? Probably not. Stop prescribing eating disorders to fat patients in the name of health. And if you're a person who doesn't necessarily have an eating disorder, but is being told to go on a diet, you have the right to question. You have the right to tell your healthcare professional that's, saying go on a diet or start a GLP-1 or da-da-da. You can say, sorry, can I just ask, why are you willing to put me at risk of an eating disorder? Just ask them. So, why do you think it's okay to put me at risk of an eating disorder? ? And if they say what risk, you can say I'm 18 times, if you prescribe severe dieting methods, studies have shown that that's 18 times more likely to develop an eating disorder. And I would say, especially if you're a parent of a fat child and you're listening to this, I remember being in an appointment with a pediatrician, and they brought up my son's weight, and I fucking lost it. And I went, no. No, sorry, not at this age. You don't get to do that. You don't get to put my son at risk. And I lost it then and there and I wrote a complaint letter. I will not let a pediatrician put my child at risk of an eating disorder by telling them they're too fat. And you know what? It's all a load of nonsense anyway, as we will discover later on, both in my book and in this season, and as we already know, children should just be allowed to eat whatever they want, and all of this nonsense has to stop. But you will not put our children at risk of eating disorders. Pediatricians don't get to do that. So if you happen to have a child and they're being fat shamed by a nurse or a doctor, you just hand up, go, excuse me, can I just ask why you think it's okay to put my child at risk of an eating disorder? Up to 18 times more likely to develop one if they start dieting at this age. Just say it and shut them up. All right, that's me done. It's my lunchtime and I'm going to go, but it's actually past my lunchtime, so that's unacceptable. Thank you very much for listening. It's been a pleasure recording these episodes. I knew this was going to be a challenging one, and I was like, do I do it? Do I not do it? Maybe I don't record this, but I'm glad that I did, because I think it's an important part of all, like when we're talking about the harms of dieting. We'll talk about weight cycling, we'll talk about the Minnesota semi-starvation experiment. We don't talk about eating disorders enough, especially eating disorders in fat people. So thank you very much for listening, and I'll see you again next week.